Hello, welcome to the Kansas State Veterinary Diagnostic Laboratory YouTube channel. This presentation discusses testing bulls for Trichomonas fetus. Similar to all diagnostic testing, when testing bulls for Trichomonas fetus, receiving accurate results is crucial. The only way to ensure accurate results is to follow correct sampling and shipping procedures. This video will introduce you to the proper methods for collecting and submitting samples to the diagnostic laboratory. The materials needed for successful trich sampling include a 12 cc syringe, a guarded sterile infusion pipette, a pair of scissors, disposable gloves, a 60 cc syringe, saline, disinfectant, a permanent marker, an in-pouch TF media pouch, paper towels, and a container for holding inoculated pouches. Proper restraint of the bull is necessary. Clip the hair from the end of the sheath. Make sure the scissors are clean and disinfected between each bull. If there is gross contamination of the preputial pouch, rinse the area using a 60 cc syringe and physiologic saline. Use a new set of gloves for each bull to prevent cross-contamination. To collect, attach the 12 cc syringe to the guarded, sterile pipette. Insert the pipette into the sheath until the end of the pipette is about 6 to 8 inches from the fornix. At this location, push the pipette through the pipette guard. Now, apply constant negative pressure on the syringe and scrape the pipette against the penis and prepuce approximately 15 to 20 times. Use your free hand to guide the pipette end to assure proper sample collection and protect the bull from injury. Then remove the pipette. A properly collected sample will contain approximately 1.5 to 2 mL of schmegma. If an insufficient sample amount is collected, start the collection procedure over with a new pipette and gloves. Schmegma samples that contain a small amount of blood are acceptable. Refrain from using extremely vigorous collection procedures, as this may result in injury to the penis or prepuce and/or large amount of blood, which may interfere with the test results. The only acceptable collection media is the in-pouch TF. It is important to make sure the expiration date on the pouch is valid before use. This date can be found on the lower left corner of the pouch. Tear the plastic strip from the top of the pouch. Insert the pipette into the upper pouch compartment. Using the syringe, aspirate the collection media into the pipette several times to remove the schmegma. Following inoculation of the pouch, discard the pipette and syringe. Now fold the pouch over several times to force the fluid from the upper compartment into the lower compartment. Seal the pouch using the white tabs. Please do not use tape or staples to seal the pouch. It is critical to record the bull's identification number, the date of collection, and the veterinarian's name with permanent marker. Do not make marks on the clear areas of the pouch. It is very important to keep the inoculated pouches between 59 degrees Fahrenheit and 100 degrees Fahrenheit from the time of collection until arrival at the diagnostic laboratory. The shipment of trich pouches falls under the Category B infectious substance guidelines set forth by the Department of Transportation. These requirements include shipping specimens in a triple packaging manner. First, the trich pouches must be placed in a secondary container such as screw-top plastic container or plastic bag. Additionally, these secondary containers must contain absorbent material such as paper towels to absorb any material that may leak from the pouches during transit. The secondary container then should be placed in a rigid container with additional material added to provide cushioning and to protect against extreme temperatures. Do not ship trich pouches on ice. Make sure the bull IDs on the pouches match the IDs on the submission form. 2 types of laboratory tests are available: culture and PCR. We routinely follow a positive culture with a confirmatory PCR. Mark the appropriate test that you want performed on the submission form. Place the submission form in a Ziploc bag and place on top of the packing material under the lid of the outside shipping container or carton before sealing for transit. It is important that inoculated pouches are received by the laboratory within 48 hours after collection if requesting culture, and 72 hours if requesting PCR. Again, make sure the inoculated pouches are kept between 59 degrees Fahrenheit and 100 degrees Fahrenheit before and during shipment. Do not ship pouches on ice. By following the guidelines presented in this video, you will be assured of receiving valid Trichomonas test results. Thank you for tuning in to the Kansas State Veterinary Diagnostic Lab YouTube channel. If you have questions about this video or any of our services, please visit us at ksvdl.org.